My name is Mary TUNISON. I came to the Parkinson's Institute in April as their Director of Development. And I have not had a job in 25 years that has been as fun as this job. And I'm going to get verklempt when I talk about it. When they asked me to do this introduction to talk about the benefits and the side effects of Parkinson's disease, I went through the list of side effects that are known for Parkinson's disease, and I thought about all the things I could say about it. But I really don't have Parkinson's disease, so it's not fair for me to talk about it. Parkinson's disease actually isn't in my family. Alzheimer's and cancer gets my family. But what I thought I could talk about for a minute are the side effects of me working at the Parkinson's Institute. The first thing that happened is my M&M consumption has gone through the roof. When the board comes by, I got to have M&Ms, and for some reason, I got to eat them too. The second big benefit I've had is I've met some of the nicest people I ever have in 25 years of being a fundraiser. People who care passionately about this disease and want us to do something about it. And I promise you, there are 70 people in this building who are working really hard to make sure that in a few years we don't have to have these meetings anymore. Dr. Langston is our leader, and there's a whole bunch of other people who are doing good work every day. I found persons with PD have a great sense of humor. One of my board members talks about his fancy new iPhone when he tries to touch it, to use the touch screen on it. Because of his PD, all of his messages begin with, hello. You gotta laugh. When life gives you lemons, I think you gotta make lemonade. Today we're just serving water, but you know what I mean. I am proud to stand in front of you and to offer this workshop to you. We have a wonderful group of speakers. If you've read far enough ahead in your handouts, you know we're going to do an art project. Yes, you can take the crayons home. It's our little gift to you. It is my great privilege to introduce the person who's going to help guide us through this afternoon. He is a patient here at the Institute, a raconteur we've discovered this afternoon. Seems to be an awfully good guy. And I'm proud to introduce Mr. Bill Schaeffer.
A raconteur. I like that one. Here's the strategy for today. We have a panel of 3 wonderful people. I had the privilege of meeting and chatting with them a little while ago. And they're going to be addressing the topic of treatment and side effects for PD. And I'm going to allow each one of them about 8.5 to 9 minutes at the podium there, and then they sit down and the next one follows, and so on. But at the end, after each one has made his or her presentation, we're going to have a question and answer and comment period of about 20 or 25 minutes. So I have the advantage of having the names of our panelists and a little bit of a bio. You don't have that, so I can put anything in here I want, and they're going to have to live up to it. I want to start with Paul COREN. Paul, you want to wave your hand? And there he is. Paul is a lawyer. He was working in Denver, Colorado, and moved here in 1988 to get into the field of intellectual property law, which many of you may not know much about, but it's quite a hot topic these days, and how. Our next panelist is Cindy DeLUZ. And Cindy is an artist, a mixed media artist. And mixed media, if you want to know what that means, go down to where the cookies are downstairs, get past Gloria, and you'll see 3 examples of the most wonderful and colorful paintings and creations that you can imagine. So Cindy, we're very fortunate to have her this afternoon for her presentation. And Tom FOLLETT is the chairman of the board of the Institute. So he really could not say no when they approached him and asked him if he'd like to say a few words. Tom has lived in Germany. He's been involved with Accenture, the high-class consulting firm, for 5 years in Germany. He speaks excellent German. And he's also a golfer. and his handicap is 14, and he invites anybody that would like to see whether PD and golf can mix to contact him after his speech. So that's about it. Paul, if you'd like to start off, and welcome to you.
Thank you. Thank you, Bill. They say that it's a dictum of good public speaking to always be shorter than anyone dared to hope. I've actually prepared slightly longer remarks, though, so I figure my solution is to tell you, don't hope for too much in that regard. So my name is Paul COREN, as you know, and I've been diagnosed with Parkinson's and a patient here at the Institute since 2000, 11 years. And I want to start by giving you a quick summary of what Parkinson's is like for me, very briefly, and then I'll talk about the IMPACTS clinical trial, of which I was a member, which I was a part over the last 6 months. Before I do that, though, I'd like to see if you're willing, by a show of hands, how many of you are Parkinson's patients who've only been diagnosed recently, say within the last year or two? And how many say from 3 to 5 or 3 to 7 years? And longer than that? Okay, so there's a good mix. In terms of my symptoms, the reason I mention that is because people I find are quite curious, surprisingly curious about what it's like to have Parkinson's. And also Parkinson's patients are very curious to compare notes. So in terms of my own symptoms, Parkinson's affects mainly the right side of my body. And my handwriting is, I've essentially become a lefty from being a righty before, so my handwriting is not legible anymore. And I button everything with my left hand and use my left hand basically instead of my right hand. In terms of the symptoms, I have not very much had tremor, but I've had a fair amount of slowness of movement and rigidity. And that includes episodes of freezing occasionally, and which is what happens when the environment gets too complicated for my brain to handle. And there's a lot of obstacles around, and I just come to a stop, for instance. I also experience falling occasionally in those same circumstances, and it's considerably worsened by things like stress, not eating, not having my medication, and so on. And then I also have, and I'm having a little bit of it right now, dyskinesias, which are responses to the medication itself, I understand. And what happens is that the right side of my body shakes a little bit, and it shakes the rest of my body. It also has an interesting effect, which I've noticed recently. My mouth tends to turn up like this, and people out in the world think I'm smiling at them. And I've just recently decided to go with it, and so I'm smiling at everybody. And you'd be surprised at people that, big gigantic, mean-looking guys, for instance, smile at you, back at you when you smile at them. I was kind of surprised by that. So let me go on and tell you my experience in the clinical trial. Franklin Delano Roosevelt said that there's nothing to fear but fear itself. He said that in his first inaugural address. And I think he was certainly someone who knew whereof he spoke. He actually had a debilitating physical disease himself, originally thought to be polio, now maybe considered a demyelinating disease. It was very serious. So I think that the key for me in my experience with Parkinson's is to manage the fear somehow. Because the fear prevents you from doing the things that you can do in addition to the things that you can't. And there are many things you can do, as you know, with Parkinson's to help yourself, and one of those is to participate in a clinical trial. And I participated in the IMPACTS clinical trial, and I basically had, I would say, I describe it as there are costs and benefits to it. I don't say there are good things and bad things because I experienced no bad things in the clinical trial. I don't say that there are positive negatives. There were no negatives. There were just costs of the trial that I had to bear and benefits of the trial. So in terms of the costs, there are basically two. One is simply the time. I basically had to come in for appointments to the Parkinson's Institute maybe half a dozen or more times. And if I lived a long distance away, it would have been possibly difficult to do it because I used to live in Novato, and to get down here from Novato would have been, and back, it would have essentially taken the whole day. But I live in Sunnyvale, so it was fairly easy for me to participate. The other cost was that you have to make an effort. And again, I don't want to overemphasize that. It wasn't, I mean, the worst thing that I had to do was to fill out a half-hour diary 3 times from morning till night, from the time I woke up in the morning until the time I went to sleep at night. And every half hour you have to put down how you're doing. Is your medication on or off? Is it working or is it not working? Are you awake or asleep? Are you having dyskinesias, which is these writhing movements you can actually see in me right now? Or are you, and if you're having dyskinesias, are they troublesome? Are they bothersome? And it's actually fairly hard to make yourself disciplined enough to sit down and write fill out the boxes every half hour, because you're always doing something else. But it actually turned out to be very useful for me, because I learned when my medication was on, when it was off, I became more sensitive to that. I also noticed how stress affected my dyskinesias, and also how just the sheer timing of the medication going on and off affected me. So those were the costs, and also the incidental benefit of keeping track of the diary. Let me tell you what the benefits are. And for me, by the way, I should say that I did not get any, when I was asked to speak to you today, the people the study coordinator and Lauren, Liza and Lauren did not ask me what I was going to say. And they haven't asked me to this date. So I think they're pretty understandably confident in what I'm going to say, and I have actually good things to say about the trial. Because when you come in, when the Parkinson's truck sort of rolls up to take you on the adventure, you're essentially getting the Parkinson's rockstar treatment. You get all the latest and greatest tests. You get they spend as much time with you as you want. They're very careful to see that you're reacting okay to the medication. I mean, it's not like winning the lottery and going to Disneyland, but that was never in the cards. So the care that you get, and by the way, the care that I've been a patient here for 11 years, and the care has been very good. And I have no complaints about it, but really, they're watching you much more carefully when you're a trial patient. And as a result of that, but the key that they managed to do was to make it personal. I never felt like a number. I never felt like this was being done for me just because I was, a patient in a trial, which it partly was, but there was also, very personal relating to me as a patient. So that's one benefit. Another benefit is that the medication was actually better than the medication that I was taking before I started the trial, and I'm continuing on to take it, and I will for a while longer. I actually had no side effects to the medication, which was one of my fears before I started the trial. And the medication that I got as part of the experimental medication was actually better for me than the medication, as I said, that I've been taking. So that was a benefit, and actually I felt a little guilty about that, because I got essentially far more from the trial than I gave to it. Another benefit of the trial was, as I said, that I learned a lot about my experience, and I've already described that. I learned a lot about my body and how it responds to the medication I was taking, and to stress and tiredness and so on in general. Then, of course, there's the benefit of participating and giving something back to the Parkinson's community. As I said, I felt my contribution was fairly humble, because the trial turned out to be a great thing for me. But I think it is important. Before I became a patient in that trial, I had always wanted to participate in a trial, because I do feel personally that it's important to contribute something to the effort that is being done to address the Parkinson's disease. And I see that my time is just about up, so if you have questions for me, of course, I'll be happy to answer them, and I'll be around for a while after to do the same. Thank you very much.
I am so happy to be here. Parkinson's is a funny thing. I was diagnosed in 2004. No, 2007, PD moment. And I was literally heartbroken. I was shocked. It was one of those things where I thought, that would never happen to me. I remember when Michael J. Fox came onto the scene with Parkinson's, and I felt such a deep sadness, seeing him. And at that point, I couldn't even wrap my brain around that. It was just so unfeasible that would ever happen to me. And what had happened is 5 years ago I noticed I was losing mobility on my right hand, or my right side of my body. My right leg was dragging, and I lost a lot of mobility in the right hand. Writing got really difficult, and I noticed even filling out a thank you card was almost getting impossible. And I was convinced I had carpal tunnel. And like many of you, I would get on the computer and I'd Google, and it would come up Parkinson's. And I thought, oh my gosh, this is the craziest thing. And I'd re-Google, and carpal tunnel came up, and I thought it must be it. But it must be pretty bad. I probably am going to need some surgery for this. So I ended up going to an orthopedic surgeon, and he evaluated me, and he said, does it hurt? And I said, no, isn't that great? You know, there's no pain involved. And he said, well, not really. I think we might have a brain issue. And he sent me to a neurologist. And that was before I found the wonderful people at PI. And you know, the test that they do for Parkinson's, I guess the problem I had, and I don't know if any of you have gone through this, you kind of go through this denial thing. I wanted a hard, fast test, you know, a blood test or something that could prove, yes, I have Parkinson's. And, you know, within 20 minutes, I call it the sobriety test, he looked at me and he said, yeah, Parkinson's disease. And I just about fell over, and my sweet husband was with me, and I just saw the blood drain from his face. And I just thought, where am I headed? And my daughter was 13 at the time, and I just was full of so much fear. And you know, I noticed a lot of you raised your hand that are newly diagnosed, and I really feel empathetic towards where you're at personally with it. And before I get in a little bit with the medicine, I just want to touch on, there's a poem I wish I would have brought for you, but the crux of it is if you stop running from something and you just stop and not only face it but embrace it, it can actually transform you. And I remember hearing Michael J. Fox say once, you know, if Buddha, Allah, Muhammad, everyone came to him and said they would take his disease away, but he would go back to who he was, he wouldn't do it. And I remember thinking, yeah, right, Mike. And I truly believe that now. It's interesting that when you're hit with the reality of something like this, sure, you know, you're heartbroken, you're devastated, but it can really transform you in ways I never would have imagined. If you told me I'd be standing up in front of a group speaking, never in a million years. But I think what Parkinson's has taught me is to trust, is to reach out and connect, and we're here on this planet to work together and share this experience. And it's also really taught me about the beauty in life. I notice really subtle things, the little nuances that we often take for granted. You know, the sound of the wind blowing through the trees. My daughter, she's 16 now. You know, when I was first hit with it, all I could think about, oh my gosh, am I going to be able to dance at my daughter's wedding? Am I going to be able to hold a grandbaby safely one day? And now, you know, I really live for the moment, and I really enjoy my life, and I trust that there is purpose and that there's meaning behind all this, and that you can find grace. I'm much more empathetic and soulful than I ever would have been before. So in an odd way, it's been an upside down gift, and I'm always a little tentative to say that, because if you're new on the path, it's sort of hard to get that. But if you continue to trust and reach out and get involved, one of the best things I did was get involved in a support group, which is really a hard decision to make when you're newly diagnosed. My fear, even when I come here, you know, and I'm 5 years into my disease, you know, gosh, am I going to have the strength to see more progressed cases? And, you know, we're told as Parkinson's patients, don't compare, you know, your disease is your disease. But it's a little overwhelming when you see folks with advanced symptoms, and, you know, you can't help but look at where's my future headed. So for me, Parkinson's has really taught me to take one day at a time, take a deep breath, live for the moment, and enjoy life. A little bit about my journey with it. The mobility issue, we wanted to start me on some medications that would help loosen up the stiffness I felt and get me moving a little bit better. And I originally started on Mirapex, which is a dopamine agonist, and probably many of you have done a similar route, and amantadine. I think I started on that. We pulled me off amantadine because I had some issues with nightmares and just insomnia and some issues around sleep. The Mirapex worked well, except the sleepiness that was attached to that. So usually I wouldn't drive for a period of time right after I took it because I would get a little bit sleepy with that. But as time went on, we kind of held off on the Cinemet until we knew I was ready to transition into that. I got a little bit obsessive, and I've heard stories where people do online shopping or gambling and other things like that. Well, mine ended up being art, which isn't such a bad thing. And I got so involved in it, and I had a lot of issues with insomnia, which I'm trying to work through now. So I ended up staying up, you know, many, many hours, sometimes 24, 48 hours at a time, painting. So my husband's basically the sleep police. So it helps if you have a partner that can kind of watch things and help you with that. The other issue I had with the Mirapex is I got a little obsessive around food and really got munchy. So I'm only 5'2", and over that period of time, my weight really shot up. And I peaked out at 235, which was really hard on my joints, and it got more difficult to walk. And my right leg drags, and walking really became a challenge, even to go to the pharmacy at Target. I don't know why the pharmacy, they always put it in the back of the store. And just to get from the front door of Target over to that pharmacy, I'd stop about 4 times. And I just assumed it was Parkinson's, of course. And I thought, yeah, the weight might have an issue in that. So, and during that time, I started on creatine, a creatine clinical study, which is, I'm pretty sure it's an amino acid that I think bodybuilders take in, and they think there's some neuroprotective benefits from it. And it was a blind controlled study, so I could have been on it, and I might not have been on it, but you don't know in a study like that. And they when you're in a clinical study, they have you come in regularly and they do blood work on you. Well, during that period of time, my liver enzymes really skyrocketed, and they continued to go up and up and up. And so we got very concerned. One thing led to another, and I ended up having a liver biopsy, which showed first stage NASH, which is non-alcoholic cirrhosis of the liver. And I'm not a drinker. Well, come to find out, I had fatty liver from just terrible diet and so much weight being put on my body that the liver was starting to shut down. So they pulled me off the creatine, and my medical team got together and they decided that a gastric bypass surgery was a really good option for me. So 6 months ago, I ended up having gastric bypass, and I've lost 77 pounds so far, and I feel like $1 million. I mean, it's amazing. I can walk so much better now, and I thought it was the Parkinson. So what I would want to share with you as a group, really, you know, we're told to eat well and nutritionally. I think Dr. Brandenburg is going to talk about nutrition and Parkinson's. If I learned anything through this journey is we really have to eat well and really fuel our bodies with the right stuff. And I was very disrespectful to my body, and I think I used food as a medication to numb myself, and you know, it was a treat to eat ice cream and, you know, cover up some of the feelings I was having about the Parkinson's. So I'm feeling amazingly good. I mean, symptom-wise, I probably feel 50% better with the weight off, which is good. I'm still waiting to sign up for a clinical study. And if you haven't done a clinical study, I mean, I really recommend it. It was really an awesome thing, and you really get personalized care. You do have to get to PI fairly often, but I mean, they go through everything with you. They watch very closely, and it's something I highly recommend. And I will be here. I have some of my art up here if you have any questions about art, and we'll be doing a project later, so we'll have some fun with art. Thank you.
I would speak without the mic, but my wife keeps telling me that I don't speak very loud. I think that I do, but she says I don't. So maybe the mic will help. Thanks to Paul and Cindy, those are great stories and they can relate. Familiar things. It's a pleasure to get up and talk about Parkinson's. I try to do it whenever I can with individuals. I find that people enjoy and get benefit from listening to stories about Parkinson's from a patient. You always get to meet with doctors, but sometimes the personal side is a little bit more helpful. I was diagnosed 10 years ago, and it was a shock, I think, as everybody realizes when the doc finally says, all these symptoms you've had for the last year or 2 years turns out to be Parkinson's. I actually was diagnosed by my internist and ended up going up to San Francisco, UCSF, for final confirmation. And I know in my first visit when I was with at the clinic up there, the bad news was, yes, it's Parkinson's, but the good news I got was, the more golf I play, the better I'd be. Yeah. So I said, Doc, you know, that's a pretty easy prescription to follow. And so ever since then, I've been taking that seriously with my other medications. My symptoms are fairly generic. I've got tremor, I've got some gait and some balance issues when the meds don't work. I think everybody's different. I feel fortunate. I mean, the fact that you have the disease is not good, but I feel blessed that it's really not as bad as I thought it would be, and I think I'm one of the lucky ones that have a slow progression and minimal symptoms, and at least symptoms that are treatable by the medications. I think, you know, some of the more difficult symptoms unfortunately cannot be treated, and I feel blessed that actually my symptoms are fairly well treated by the medication. I'm probably going to be a little more clinical in my discussion, which hopefully is helpful. I'm currently on a form of levodopa, and I've been on that for 5 years. I'm on an agonist, a Requip, and I also take Azilect because I think that that is neuroprotective. When I started the Azilect, I don't think I really got any benefit from it, from the symptoms, but I think it's helped in putting the disease off. I take medicine 4 times a day with the levodopa, and I take the Requip 3 times a day. So I find that when I get up in the morning, I'm a little better than the rest of the day. And I think that's fairly common with the disease, that you get a boost from being asleep. And so I'm best in the morning, and especially then when I go to bed. So what I try to do is maximize the on time that I have with my levodopa. So I'll get up, and I guess the message I'm going to try to give you is be very specific about the medication and the way that you take it. You can maximize the benefit of the medicine if you pay attention to it. So what I do is I get up and try to take my Requip at 7 o'clock with maybe a little bit of food. And that helps a little bit. I mean, the Requip doesn't solve my problems like the levodopa does. And then, but I'm still pretty good because I've got the rest from being asleep. And then about 8 o'clock, I take my first levodopa. And it takes maybe 45 minutes for that to kick in. But the interesting part is, when it kicks in, it says, yeah, I'm back on it, and I feel good. It just is actually a great feeling, and for me, it's very specific. I mean, it is not on, boom, I'm good. And so I take that 4 times a day, so I take it at 8. I take it at 11, which is 3 hours difference, because it wears off faster on that first dose. I take the second one, and I usually get until about 3 o'clock, so that's like 4 hours. And then I go in about 6:30 for my last, well, I take one at 3, and then I take one at 6:30, which is really my last one. So what I'm trying to do is maximize the effect of levodopa over the day. The Requip I take at 8, I take it at 12, I take it at 5. And so one of the things that I found, and in talking with Dr. Langston, he's explained it, is that the levodopa is more effective if you take it on an empty stomach. So that's why in the morning I get up and have either very light something to eat or nothing at all. Because as he explained it, the levodopa is absorbed in the duodenal, which is outside of the stomach. So if you have a full stomach, that valve is closed down, and you take the medicine, it just sits in your stomach. And it's not doing you any good in your stomach. It's not until it passes out. So I become very anal. My wife is a saint because, oh, it's not time to eat. Oh, it's too early, it's too late. Because I'm trying to time my medication with an empty stomach. So I'll try to take it at 8 o'clock and then wait 20 minutes or 30 minutes before I have anything to eat, because if you eat too soon, it's not going to get out of your stomach, it's not going to be effective. The other thing that happens is, well, and I guess that's the other thing I was going to mention is, when I eat lunch, I try to eat fairly light, because if you have too much to eat, you take it at 3 o'clock, it's still going to be in your stomach and not get out. So sometimes I'll have a little bit later lunch, I'll go and I'll have a little extra to eat. I'll take that levodopa at 3, it doesn't show up. It's amazing how sensitive the medication is to working sometimes and working better at other times. The other thing, and I think the docs will talk about this later on, is the amount of protein that you have. I was given the example earlier where I went out in the morning and had a 3-egg omelet, all egg whites. You know, a huge amount of protein. I got to the golf course, it was like it disappeared. I didn't have any relief from my symptoms, and I think it was because of the protein that was in those egg whites that made an impact. So it's the medication has to get through the blood-brain barrier, and as Dr. Langston explained it, he said, you know, think about a train station, and if the train station's crowded, it's going to be hard for you to get through the crowd and onto the train. If it's empty, you can walk in and directly into the train. So if protein's trying to fight with the levodopa to get into the brain through the blood-brain barrier, it's like that crowded train station, you can't get there, you can't get on. So, you know, you might want to check with the docs for your schedule, but an empty stomach to me is very critical with the levodopa. I think that a couple of other things that I think are important with Parkinson's. One is positive thinking. You know, a lot of times I'll be walking around, I'll be kind of stooped over, and I say, oh, you know, I just can't move. And I said, wait a minute, I can stand up straight. I can do what I want to do, and it's just it's like it's just a difference maker in the way that I can live, really. So the more you think about what you can do as opposed to what you can't do, I think it's very beneficial. Exercise, absolutely crucial. And so I take levodopa, I take Requip, I take Azilect, and I play golf every other day. And I'm convinced that the golf helps. If I don't play golf, I walk. If I don't walk, I'll exercise. I'll stretch. Stretching is usually important. So it's just keeping the body flexible, keeping the muscles active, and makes a huge difference. The side effects, fortunately I don't have any dramatic side effects. Sometimes with the Requip, I'll fall asleep or get drowsy. The worst case was when I was on Requip and had kind of a sinus congestion and took some Benadryl and then went to a 2-hour 8th grade graduation. I mean, between my neck bobbing up and down and my wife poking me in the ribs, I was beat up. But I fortunately have not had too many side effects other than having difficulty on the back 9 when I'm in between medications. It gets tougher to swing and tougher to walk. So anyway, hopefully that's helpful. Happy to answer any questions as we go on.